Hi everyone, my name is Emma, and together with my co-authors David, Stella, and Dragan, I'm very pleased to share with you our mixed methods case study that was accepted at SIGCHI this year. Within this research, we explored medical practitioner sensemaking in the context of practice analytics using a mixed method case study approach. First, I would like to introduce to you what I mean when I say practice analytics. While we know that there is an increasing digitization of the healthcare system, there is an increase in the use of digital and electronic systems that leave behind large digital footprints. This includes the use of digital patient administration systems, electronic medical records, and digital billing, just to name a few of them. As such, there remains an opportunity to leverage the data that these systems leave behind for alternative or secondary purposes. One such example is using the data to support practitioners and their continuing professional development, or CPD. This was identified by Janssen and colleagues in 2023 as a missed opportunity in digital health. As such, Practice Analytics seeks to understand how we can better leverage this data to support medical practitioners in their learning and their professional development. And this complements international shifts towards more data-driven CPD that regulatory bodies are advocating for within the healthcare system. By leveraging such data, practitioners are equipped with better data-driven insights that without practice analytics may otherwise be unseen, and it's hoped that this would have a positive impact on the quality of care. The research that I am presenting today focuses on how we can ensure that this routinely collected data is effectively translated into CPD. How do we ensure that this data is effective for learning and development? How do we ensure that it's relevant and appropriate for use? How do we ensure that it is meaningful? But specifically, how do medical practitioners make sense of routinely collected data to inform their CPD in the context of practice analytics? So in order to explore this, we interviewed and surveyed medical practitioners after they had received what we're calling a practice analytics dashboard. On the screen is an example of this. For each practitioner, it presented how they performed for the previous quarter using metrics such as their patient's length of stay, any hospital-acquired complications, or any unexpected returns to theatre. They also received this information on a more granular level that was grouped by procedure type. In relation to the interviews, we spoke to medical practitioners about their experiences with handling data associated with their clinical performance, and this data was analysed qualitatively using thematic analysis. In relation to the survey, we surveyed 39 medical practitioners using an adapted survey that explored sensemaking, and we also added some additional qualitative and quantitative questions that explored the practitioners' thoughts, experiences, and feedback on the reporting, and the results were analysed descriptively using response distributions and correlations. First, we attained some really positive results in relation to using this data to inform CPD more broadly. Specifically, 72% of practitioners that we surveyed felt that reviewing the data should constitute towards their mandatory CPD requirements, with some even making reference to this data-driven activity being more effective than what they were currently doing in terms of CPD activities. However, what remained were challenges with interpretation, meaningfulness, confidence, and data quality issues. We found overall what makes sense or is useful for one practitioner is likely to be different to the next, that sensemaking is a highly individual process and that this needs to be accounted for within practice analytics tool design. So what did we specifically find out in relation to medical practitioner sensemaking? Well, we found that the data seemed to be effective at initiating the process of reflection. The data was successful at prompting the practitioner to think back about their previous clinical performance. And this supports wider sensemaking literature that confirms we make sense of things by relying on and using our past experiences. It was also found that the data was deemed to generate new knowledge surrounding information and insights. This was done by creating unexpected insights for the practitioner and allowing them to focus on specific areas of their performance. Another thing that was found was that practitioners felt the data within the dashboard was not granular enough to be linked to their practice. They commented on the need for data that was relevant to their specific specialty area, a more individualized report. That being said, the data was deemed objective in terms of providing evidence and evaluating performance. However, finally, the data seemed to do little by way of challenging and changing assumptions about performance. We felt, however, that this may have been because practice analytics is in its infancy, that the practitioners actually don't have any current assumptions about their performance in relation to the data. Responses to this question may change if practitioners had more routine access to such data, dashboards, and reporting on a more routine basis. We present within our paper some of the key recommendations for further research and practice. First, in relation to future research, we need to consider methodological approaches that celebrate the individual at the heart of the intervention, for which we advocate for ideographic methodologies. Such approaches seek to understand the highly individual phenomenon, so that's like sense making in this case, and may offer insights that help tailor design and development. This, of course, should be supported by co-design and integrated with policy. Next, in relation to practice, we illustrate a need for individualized reporting that needs to become integrated into routine practice. That is, practitioners should not expect to review data in order to support their learning and development in isolation. It should not be seen in a negative light. In addition, we should be aware that many different factors mediate sense-making, including changes in needs, frames of reference, and also emotion. Specifically, our takeaway from this research was that one size will never fit all when it comes to sense-making, and this needs to be accounted for within tool design and development. Thanks for listening.